Welcome back into Everyday Kentucky. The 2022 Markesbery Symposium on Aging and Dementia is taking place next Saturday, November 19th at the Central Bank Center downtown. And joining us now is Associate Director and Professor Dr. Chris Norris is here to tell us more. Good morning. Thanks for being here with us.
Thank you for having me. It's a pleasure.
Great to be here. Dr. Norris, talk a little bit about, first of all, I was talking about Breeders' Cup a minute ago and how great Lexington does things, right? Mm-hmm. We have one of the top facilities, staffs in the nation on aging and dementia over at Sanders Brown. So first of all, thank you all for not only the work you do to help people all over this country, but especially to help Kentuckians each and every day.
Yeah, not to brag, but it really is a great center.
It is, it is.
Back in 1979 is when the center was born, and we have a mission to do research on aging-related neurodegenerative diseases and dementia. We have an education mission, an outreach mission, and then a clinical mission to treat citizens with dementia, support caregivers. And in the mid-'80s, we were one of the original 10 NIH designated Alzheimer's disease research centers.
It's amazing.
So it's a really big deal. There's only 30 of these, and we're one of them. So Kentucky should be really proud of this.
And you've got a big symposium coming up that's going to talk even more, and people can learn more about the subject too, right?
That's right. That's right. It's going to be great. We have some really great speakers. So we have two keynote speakers. One is Dr. Joshua Grill, who's at UCI Mind at University of California, Irvine. So he oversees recruitment and retention of volunteers and participants in their clinical trials. So these are studies to look at the effects of drugs on humans.
Sure.
So these are very logistically difficult to set up and coordinate. And when you combine that with how complex something like Alzheimer's disease is, these two things together, it's a pretty formidable obstacle to find a treatment or a cure. And so he's going to talk about how we design better trials to look at drugs.
Doc, we've gotten some information, I think it was recently, about a hopeful drug that can maybe help with this. Am I right? Did I hear something about that the last few weeks?
Yeah, so in the last year or so, there's been some advances. So there's a drug, the first FDA approved drug for Alzheimer's disease since I think 2003.
Something like that, yeah.
And the first disease-modifying drug, it's called aducanumab.
Right.
And it reduces amyloid deposits in the brain. Sure. It's kind of controversial. There's been some mixed reviews of it, but it's something that I think is maybe kind of getting us on the right track.
That's right. Doc, as we look at this, Jim, let me ask one more thing. You see the information. There's also going to be a discussion about Alzheimer's and the relationship between football head injuries. We had one of the guys worked here with us that was part of that NFL deal. But the other thing, Doc, is I don't think people understand this. I lost my mom to dementia in 2018. You can actually get tested. It's kind of like a baseline, right? Where you can establish a baseline, and then when you think to yourself, golly, am I slipping? I mean, you've got a baseline.
Right. There are new diagnostic markers that kind of help us screen people that may have dementia. My mother, too, was also passed from dementia in 2021.
Right.
It's a very hard thing to watch.
Unbelievable. Yeah. Unbelievable. Well, Doc, thanks so much for what you all are doing, and you do it each and every day. And I think it's one of the great kind of secrets to the Lexington community. They're known world over, but in Lexington, I don't think people realize how blessed we are to have the aging care and specialties that we do here in Lexington. Thanks so much.
Really appreciate that. Thank you.
We appreciate it.